Okay, I'm gonna show you guys how to set up a Vamp system. So first thing, you need to grab all of your supplies. You're gonna need your pressure cables, your transducer holder. You're gonna need your pressure bag, a 500 bag of sodium chloride or NS, and then you're gonna need your pressure tubing. Your pressure tubing, you wanna make sure that you grab the one that's for single, because we're just gonna set up either a CVP or an art line. And you can tell on the back that it's just your single one. So then you're gonna open everything. I like to set up my transducer holder. Then we're going to set up our tubing. So this comes with air in it, like this. So you're going to, I like to push the air out. Then you're going to take the paper off here. And you're gonna spike your bag of NS. You'll be wearing gloves for this, obviously. The best practice is to remove all of the air out of your saline bag. So once you spike it, the easiest way to do that is to unspike it. You wanna try to keep the tip of your spike nice and clean, but you want to squeeze out all of the air as best you can, and then respike it. So now you won't risk any air bubbles getting into your line. Then I like to put my bag inside my pressure bag. There's a little hook in there, that way you can hook your saline bag in. Okay. And hang it on there, and then I like to hang it on my pole. That way it's out of the way. Okay. Then you want to inflate your bag. So it's like your blood pressure cuffs. You're just going to inflate your bag. As you inflate, your pressure gauge will go up. Sometimes a brand new bag takes a minute to inflate. Soon you'll start to see the gauge go up. You can see it's kind of going up there. I like to go until I see the green. So there. And then you want to put your stopcock up. That makes sure none of this air leaks out and you don't have to continually add air to it. If you leave it open, it'll just slowly leak out air. So we're going to leave it like that. Then you can see by doing that, we've already gotten some fluid into our chamber. So you're going to treat this just like a normal IV tubing. You're going to fill up your chamber. And on your actual pressure tubing itself, there is this little pigtail, a little blue pigtail, and then the end is here. So I just like to pull the little pigtail until I get all the air out of my system. You can see that. So we got all the air out. Then you want to put your tubing on your transducer holder. It kind of can only go in one way. So it just goes there and there, okay? Then you will hook this up to your patient's either art line or central line or PICC line or wherever you're using your Vamp system. This will go to your patient, okay? So now the other thing I wanted to show you is this cap right here comes already attached. This here, the problem with this is there is a hole in there. So you don't want to keep this one on because you could run the risk of getting your patient like eclampsia or something. There's a little hole in there. So you can either grab your normal blue dead enders, or the kit actually comes with one itself. So you'll put that here. So if you're just drawing blood, this is all you need. Now, if you are wanting to transduce, whether a blood pressure or a CVP, I'm going to show you how to do that. We're just going to assume that it's connected to the patient. So you'll grab your pressure tubing, your pressure cable, I said it again, and then you will plug it into your monitor. And then you'll plug the same end. I use the blue, so I'm going to use the blue down here. Then we're going to zero it. So the best way to zero, or the easiest, you just have to zero to atmosphere not your patient. So right now our system is open to our patient because you can see our stopcock here is closed to me, which is air. So it's open to the patient. So what you'll do is you'll take your stopcock, move it up, open your little cap, pull your little pigtail, zero your system, okay? Zero it, you'd hit your whatever pressure you're zeroing it, and hit zero right there, zero art. It won't give me a pressure now because I'm not hooked up to a patient, but it will, nice. And then you will, once you have a zero up there, then you'll move your stopcock down and replace your cap, and then you will get a waveform. And that's it.